Hello, it's Dr. Rachel from KMC University. I'm coming to you from our help desk today. One of the topics that we've been hearing about lately is how to improve patient retention. Always a big topic in our profession, so happy to quick address that. The truth is that great patient care isn't just about delivering great adjustments. It's about compliance, it's about accurate documentation, and building trust through consistent communication. Improving your compliance and documentation practices can directly lead to better patient retention. And here's how. As a DC with a heavy practice management background, I think about this topic in two buckets: what the doctors can be doing and what your team members or administrative side can be doing. On the doctor side, maintaining compliant documentation is key to justifying medical necessity for continued care. That not only keeps your practice protected, but along with patient education, it also helps patients understand the value of ongoing treatment, which in turn will improve retention. In both cases, it explains the why behind the treatment plan. Now, don't let documentation sit on a screen. Use that to engage your patients. Show them their progress, review their treatment goals during their visits, use visuals if you have that available. You can use charts, x-rays, range of motion tracking, whatever you're normally using. When they know that you're tracking their progress and you're basing their care on real, measurable outcomes, they are more likely to stick with the plan and stick with you. Compliance isn't only about following the rules, it actually builds trust. When your patients see that you're taking their privacy and safety and treatment seriously, they feel more confident in the care that you provide. If it's from HIPAA to SOAP note standards, patients may not know the laws, but they can feel when you're organized, when you're ethical, and when you're professional. Now, team members, on that side, your staff can't perform at their best if the doctors aren't setting them up for success. Having compliant documentation is key. Having clear treatment plans, re-examination dates, maybe notes in the patient file about what OAT scores that patient requires are examples of how your staff relies on you to set the expectation of care. Based on what you recommend and what you document, automated reminders, reactivation campaigns, and timely follow-ups can happen on a consistent schedule. When your records are accurate, it's easy to track who's missed a visit, who's due for follow-up, and who may be falling off their care plan. This allows your team to proactively retain patients before they disappear, and it's good case management. Now, we all know nothing works 100% of the time. Every chiropractic practice encounters patients who stop showing up, fall off their care plan, or fail to communicate. When that happens, it's not just a scheduling issue, it's also a compliance issue. That's where the administrative discharge comes into play. Administrative discharge is appropriate when a patient is non-compliant, inactive, or fails to communicate from numerous follow-up attempts. This is not punitive, it's protective. It protects your license, it protects your practice, and the patient record. Administrative discharge is the necessary step when you can no longer justify ongoing care or the lack of it from a medical necessity standpoint. This isn't just best practice, it's essential if you're ever audited or if there's a legal or billing dispute down the line. Now, when that patient comes back in, you simply follow the proper steps to establish a new episode of care and you're on your way. Well, that's it. Dr. Rachel signing off the help desk today. Be sure to follow KMC University on our social media platforms, and we are always happy to address any challenges that you're facing in practice. Thank you.